I see patients with the early menopausal stage at around 40, 42. So, and the main organ in that period of time, it's kidney. And kidney by time is kind of, the kidney as a channel and kidney as an organ is kind of declining.
Hello everyone. So today's episode is with Dr. Elena Gregoriants. Now, Dr. Grigoryants is a OBGYN in her country, but here she is a Chinese herbal medicine doctor. So she's an acupuncturist. I really wanted someone of her expertise to come on the show who's been an OBGYN, but also now is studying and practicing Chinese medicine. And the topic is birth control and infertility. And I really wanted to get into this episode because I think this is such a major pandemic in our country. And it is, and I'm calling it that because every other young girl that you see is on birth control, and every other young woman that wants to start a family under 40, under 30 is having infertility issues. So my concern is, what is really happening? Is this environmental? Is this food? Is this something that we're doing wrong? And what is causing all these infertilities? Is birth control causing infertility? Can birth control cause cancer? So a lot of really important topics that I thought every parent would want to know, every woman would want to know. So we dive into those subjects. And also we dive into the essential organs of a woman and where it all stems from. Like, what organs do we need to nurture? And the subject was wonderful because I learned so much, and I know that I can nurture my daughter better knowing all of these important knowledge that she obviously spreads. So stay tuned, and I hope you enjoy this episode. Please subscribe to the channel if you haven't done so. I think it's such an important piece in supporting this podcast. And one really important part of this podcast is our sponsors. And Anita's Tutoring is an amazing sponsor that I want to bring up. She is helping children of all ages, working on reading, critical thinking, their English. And so I think that she's such an important piece in any community. Definitely utilize her services and message her. I will definitely link her tutoring center into the YouTube and into my Instagram. Somebody so wonderful, works great with teachers, works great with students. And what I love about Anita is that she has been a teacher for some time now, you guys. So she has all the experience that there is in private and public schools. So Anita's Tutoring, thank you for being a sponsor, and we appreciate you. And enjoy this episode, everyone, with Dr. Elena Gregoriants. Hi, Elena. How are you?
Hi, Edith. I'm okay. How are you?
Good. It's so nice to connect with you. Thank you so much for accepting my invitation.
Thank you for invitation too.
Of course. I'm so excited about this topic because this is something that I think is not really talked about, what we're about to get into. It's not discussed. It's not really talked about. And I think it's important for people to hear that there's many other stories behind topics, and it's really good to educate themselves before leaning into other things. But before we get in, can you just briefly tell us about your educational background? I know that you practice in your country as an OBGYN. Here you are a master acupuncturist in a Chinese medicine. So walk us through your education a little bit.
Okay, I graduated from Russian Medical Academy. It's Ivanova Medical Academy. I have been practicing as obstetrician and gynecologist for 11 years. So basically, I'm from the Western field. I have a Western background. So I graduated in 2016, from Yosan University here. It's University of Chinese Medicine. And I'm practicing I have been practicing since 2018, and I'm running my own business, Panacea Acupuncture. So
That's
I'm a
beautiful.
licensed acupuncturist and master of Chinese medicine.
Do you think that there is do you think that there's a difference between like Western medicine, and I believe the Chinese medicine is Eastern medicine, correct?
Yes. So basically, yes, this is two different worlds. One of them it's a
Yeah.
Western,
Yes.
completely Western, and another one it's a Eastern. But I can tell because my education that days, during the educational training time, we had some elements in our program that I have been having in a Chinese medicine training. So it's basically observation. So the most important part in my time that I have been studying Western medicine, it was an observation. So in
Wow.
Chinese medicine, observation is number one too.
Yeah. Which do you connect with more now that you are, because they are two worlds, but what do you connect with more with, Western or Eastern medicine?
Um, you know, I, you know, I like Chinese concept that there is a yin and yang, right? The yin, it's like a kind of a dark side. I mean, it's not dark. It's a material part. And yang, it's a energetic part. I would say Western and Eastern, it's a yin and yang. Western, it's more material. And Eastern, it's more about energy. But when we connect them and fuse them with each other, it's a very good blend that I feel that it helps me to treat my patient and apply, some Western diagnosis in a Chinese medicine prospect.
Bringing on and having the knowledge in Western and Eastern medicine, Eastern practices more on energy, yes, but do you feel that many healings, whether you're dealing with cancer or what have you, do you
Mm-hmm.
feel as a professional that Eastern medicine does its job with healing a little bit more substantially and better versus Western? What's your opinion?
Okay, my opinion is long time ago I had some issue. Uh,
Oh,
yes, that relates to, let's say, I was diagnosed with the cancer, but it was long time ago. And that time I had minimum knowledge about Eastern medicine, but I decided to do something alternative. And I believe it helped me. And that knowledge that, the experience that I had that time uh, helped me to understand Eastern medicine more. And I would say I have more tools to apply for patients with who have been having through chemotherapy, radiation, because I have my own experience and I have a knowledge of the Eastern medicine that supports the system. It's because in the Eastern medicine we don't divide the body by let's say brain, legs, hands, and internal organs. We see the system as is a universe, is a network. This is the
wow.
main idea and big point to help people with the cancer or some autoimmune disease, because it's a different concept compared to Western medicine.
Oh my. So do you think that the people that are struggling with autoimmune and cancer or tumors, it's because their energy is not aligned?
I would say it's in Chinese medicine, there is a concept. Qi is first, blood second. So in yang is first, yin is kind of, supporting the yang, and
Uh-huh.
vice versa. There is a maybe, 3 or 4 different aspects of autoimmune problem and cancer problem. So I would say, of course, yes, it's an energy blocking in some system. It's if the energy is blocked, it block the or stagnate the blood flow. It depends. We just need to find out where is the root of the blockage, and because sometimes we see only branches, we don't see the pinpoint. The target. So that's why I said the observation, it's number one. We need to, I mean, as a practitioner, I need to see the whole picture, how the patient looks, what's the, like, the how is the skin color, how's the quality of the hair, quality of the skin, if there is, some spots on the face, spots on the hands. I mean, it's observation. It's a big, like part that helps me to target the problem. I mean, to with the diagnosis, if we need to support, let's say, kidney channel, or we need to support spleen channel, or we need to calm down the liver, because the liver, it's a manager, and it's a collector of the blood. Like compared to the spleen is a producer of the blood. So we just need to find out where is the root and help them.
No. That's amazing. And that's interesting because looking at Western medicine, we tend to, since our topic today is like infertility and birth control, we can just like go right into it. When a woman is having a complex time, having babies, I think that issue is really not looked at, observed as the way the details that you're explaining. I mean, it's looked at as like a cancer. It's looked at as like a tumor or some type of like a, something, versus like looking at it from an energetic perspective, a lifestyle perspective, right? A DNA perspective. So I want to say this, that I've noticed as a human being, and being around with lots of people, working with people, having friends, that infertility rates are increasing like there's no other. Like every other young person that is trying to have a family is having difficulty becoming pregnant. Are you noticing this as well in your practice, that infertility is just such an issue right now under 30?
Yes. I noticed this. First of all, if you look at the ages of, like, let's say, I'm talking about women right now. So they decided to have a baby after, the majority of them, they decided to have a baby after 30s. So I rarely see patients before, let's say, 26, 27, 28. Let's say in my time, we consider the first pregnancy, the woman who has the first pregnancy at 25, it's a kind of, a little kind of a little late. A little, like that time, yes. But now it's, we would say, between 25 to 32, it's kind of normal period. But we need to understand that, our hormones level and our fertility level is kind of having a peak towards to the 28, 30, and then, gradually goes down. And most of my patients, it's after 32, sometimes it's 42, 40, 42, and it's the first pregnancy. They just start thinking about first pregnancy. Of course, it's going to be the rate of the infertility is going to be higher compared, like, let's say, even 20 years ago. This is number one. And number two, you just said this is exactly lifestyle, and that we are, as like women, we became, more maybe muscular. Doing almost the same job, and taking responsibilities that, like men. That, yes. So of course it affects on our hormone level, estrogen level and progesterone level.
Why do you think? Because you're right. I think what we're talking about is that we want to be equalized and we have just as more responsibility like men do. We're out there working, we're everywhere. And we can do all these things. We're women, but we can't do all of them together well. So that is affecting us. But in what way do those stressors, can we call them stressors?
Yes, I think so. Yeah. Mm-hmm.
In what way do stressors cause infertility?
So, I don't want to be right now as like a more Western doctor. Let me just talk as a Chinese medicine doctor because,
Yes.
I have patients and I'm practicing Chinese medicine. So, again, we need to apply by two systems. One system, it's a liver. Another system, it's a kidney. So, before 40, 45, the main organ in our body, I'm talking about women body, it's a liver, because liver is collecting the blood and supplying the organs with the blood, and of course it's a producer of the hormones.
The liver is.
Liver, yes. But after 45, 45, sometimes it's even 40. I mean, I see patients with the early menopausal stage around 40, 42. So, and the main organ in that period of time, it's kidney. And kidney by time is kind of, the kidney as a channel and kidney as an organ is kind of declining. Mm-hmm. They really losing their volume. They really losing their tissue. So basically, we need to just see what the age, the patient age or the woman age. Where is she? She's like on the liver side, or she's more already close to the kidney side. And we need to support the system. If it's a liver, we need to support the liver. Because, like stress, as I like work, and a lot of women, they're running business. Again, it's a stress and, work and maybe lack of sleep, lack of,
lots of thinking
and everything. Yeah. So it will affect on liver. So, and liver became kind of stagnated. We call this liver chi stagnation. It creates headaches. It creates even, that we call the syndrome PCOS. So because of the liver is blocked. And if the liver is blocked, it blocks the flow in the pelvic area. This is number one. So we need to unblock the liver to lower the stress level, to, give more blood supply. If we apply to the kidney, we need to support the kidney because the kidneys they're becoming weak and cold. So we need to give more essence, like support the essence. So it's a different treatment. So one of them, it's kind of deficiency and excess and maybe heat. Another one, it's deficiency cold. Two different, right? So that's why we can say, we need to give the same treatment for two different, women with different ages.
Mm-hmm. So the since we're on the topic of liver and PCOS and some of the symptoms, the younger girls around 12, 13, 14, 15 that are struggling with like menstrual cramps and heavy menstrual cramps, and they're given birth control to help with that. Is that a normal thing to do, or is it something to look at the liver of these girls and say maybe their body's under stress versus shoving medicine down their throat like birth control?
Yeah, I agree because, I would, given the birth control, the idea of the birth control, taking the pills of birth control.
Yes.
Should be applied to, the main business that pills is managing. So it's a birth control. If you're talking about the young girls that they have cramps and sometimes they could have some cysts in the ovaries.
Yes.
Again, this is the liver. It's exactly liver blood, and liver, we call it, as I said, liver chi stagnation. And sometimes this stagnation creates, of course, there is no free flow in the pelvic area. And it's kind of, collects the blood around the ovaries and in the uterus and in the system in the lining of the pelvic floor. So just the flow became stagnated, and given the clinical presentation, it's a pain. So what we need to do, we need to relax the liver to stimulate the blood flow in the pelvic area. And sometimes it could be cold condition, and it could be heat condition. We just need to see the presentation. If it's cold, we use, I believe you remember, we have been using moxa. It's an herb that we burn on the needle, or there is a moxa stick that helps to, during the menstrual cramps. And in Chinese medicine, we have some herbs that unblock the liver and stimulate the blood flow exactly in the pelvic area.
I think that a lot of mothers with young girls would really appreciate knowing this, because we're so led by lack of knowledge and fear that so many parents do give their young girls birth control because they have such pain.
Because they don't know, they don't know about. So this is the problem of the education again, that it should be, maybe some educational, talk or educational videos that help young generation to understand that besides, of course we can switch if it's a critical situation, nothing help, but we can go step by step. We can start from the alternative medicine, given, acupuncture again, given herbs. And then if it did not work, we can switch to Western, to the more heavy, treatment. But we can start from the,
Yeah, I agree with you. Learn how to put your socks on first before your shoes. I learned that. Elena, what negative impact does birth control have on the body of a woman?
I would say you even can Google. When you Google, you can see that the problem with the birth control that it help. It's effect on the water retention, and water retention. Some women they could have a gain in the weight, emotional aspect of gaining weight and water retention. But basically, it again affects on the liver channel and liver venous blood. So there is a kind of a side effects of, it's not a secret, you can just find out that the side effect of birth control, it's problem with the vein flow, especially again on the pelvic area, and legs vein could be involved too.
And what problems can occur from that?
So it's maybe the critical situation that could happen, it's thrombosis, or in the future, clots in the big veins, and it could affect during pregnancy. Some women could have with the problem in the pelvic area. It affects on the rectum. It's hemorrhoids and bleeding in the pelvic area, because first of all, the idea of birth control, it's lower the estrogen level, because we need to kind of stop ovulation, and also it's decrease the estrogen and progesterone. I just said about the critical sides, but there is another side. It affects on the sexual life, because low level of the estrogen affect on the libido. So it's kind of,
So what's the point of taking it?
no, let's just say that that time when they created birth control, it was kind of revolutionary step for women. We just need to, to understand, because for women having sex usually leads to, that days have been leading to having a baby, right?
Mm-hmm.
But the women that days have been depending on men. Right now we could, be independent, we could run the business, we can, even raise the baby by ourselves. But that times, it was like, financial dependence, emotional dependence. So, and, I would say maybe, 20, 30 years ago, it was like big relief for most of, like women, even for our mothers and grandmothers, because, there was some high rate of abortion and women death, and, and young women, they just during the abortion, they had some consequences, and afterwards, infertility or death.
Yeah.
So
Elena, do you think that birth control can possibly cause infertility if it's taken for a long time?
I don't want
There's
to
a lot of study. I've
yeah.
read
Mm-hmm.
research on that. But, it's always good to talk to professionals and see what their perspectives are too.
Okay, so I don't want to say that it affects on the like fertility. It affects on the fertility, because again, if I'm talking as a Chinese doctor, it affects on the liver, and I already mentioned that the liver is producer,
Women, yeah.
collector of the blood, and it produces the hormones.
Wow.
So if the liver is blocked, less blood, blood that goes to the liver channel and less blood supply. Of course, it's gonna, like the pelvic area, it's not gonna be priority for the liver to supply. And it could create, some cyst in the ovaries, or it could be, problem with the lining in the uterus. So it's kind of yes and no, but yes, because, it affects on the liver.
Yeah.
Liver blood and liver channel.
So some of the negative impacts of birth control is that it impacts your organs negatively. And especially for women, it attacks the liver if it's taken for a long time, which we're understanding that liver helps us get pregnant.
Yes, exactly. That's why, there is I believe gynecologists, they should explain that if you're on the birth, not you, someone on the birth control, it should be, for maximum 5 years. And then it should be some checkup, maybe to switch to another alternative birth control. It could be, condom. It could be, there are a lot of
other options, of course.
Options, yes, that the
to
women
cleanse yourself, right?
Educational thing. It's a problem with the education. The women. Sometimes women, if they don't know their choices.
Yeah.
So they need to know how that there are, like non-hormone choice and birth control. But for 5 years, maybe, in 5 years, it should be 1 year to have kind of a resting time, to renew the system, to reload the liver, to reload the blood flow, so to reload the brain. It's just, like for some girls and some, women, it could take even 12 months.
Yeah. Now that you are in more Eastern medicine, from an honest perspective, how do you feel about birth control? Would you prescribe it now, even if you knew that Eastern medicine existed?
No, I would explain another options.
Yeah.
So if the another options works, even, like condom, I would say it's in some cases it's more safe, because, kind of protected, sex, and we just did not talk about some diseases that we could be, transferred through.
Yes. Well, what about moms are going to say, okay, fine. So then how do I help my mom, my daughter who has severe pain? She has awful heavy cramping, awful periods. How do you argue this with those types of mom? I mean, is Chinese medicine or traditional medicine really effective in helping these young girls who are having these really heavy period pains?
I would recommend to find a good doctor, doctor of Chinese medicine or practitioner of Chinese medicine. Try herbs, try acupuncture. I'm very sure it's gonna help. At least, if not, let's say 100%, but 80-85%, it's gonna be better. And it's gonna affect on the, not only help is the pain relief, it's gonna affect on the mood as well. Because, some women who have been having cramps and pain during menstruation, they kind of have some sort of depression. Because when they close to the period, they have depression. Again, depression, it's a problem of the liver channel.
Yeah.
So it applies to liver and liver channel. TMJ, like, some of young, women, they have a problem with the pain and the headaches, migraines. Again, it's a liver channel, liver gallbladder. So my recommendation, start from easy and more natural, treatments or help. And then if it did not work, if it won't work, you can, switch to Western medicine.
What herbs help with severe cramping for?
So it's basically herbs that we have a lot of formulas, and some formulas, it's in the formula we have herbs that helps to promote the blood circulation, or we call them blood mover. Like the most famous one, it's safflower. Saffron, it's the same family. So, but safflower, safflower tea or saffron tea really, is could really help with the cramps. But someone who has this should take it regular. It's not just, I have cramps, let me just drink. No,
I was just going to ask that question, Elena. It's, and sorry to cut you off. I wanted to add to that many of us don't believe in these types of herbs and medicines because I think as people, we want instant gratification, like we want instant. But what people are forgetting is that, yes, Chinese medicine is effective, or, integrative medicine or traditional medicine is great, but you have to be consistent. It's not just that one time you're explaining like, oh, I have cramps, let me drink saffron tea and it's going to make it go away. If you know that you have a certain symptom, you need to be consistently drinking that tea, right?
Yes, and also we have a very great formula. It's a combination. Maybe when I pronounce it sounds a little weird. We have a formula Xiao Yao San and Jiao Wei Xiao Yao San. So these two formulas, one of them,
I took one of those.
Clear the heat. It helps to unblock the liver. Harmonize the liver channel. And safflower tea will just help during the menstruation to unblock the blood flow when there is a stagnation in the blood flow. Yeah, of course, it should be some daily basis, not treatment, like support. I would say it's a support. You eating every day, right? You drinking every day. So this is a part of your daily routine. And let's say I know that I will have headaches if I don't drink enough water. So I'm just forcing myself, and not forcing, I'm just, recommending myself to drink water. So the same with the herbs. It could be tea, it could be pills. It's not, right now we have the form that very useful form. It's like small beads or small pills that easy to, consume.
Yeah. from our conversation, we're understanding that birth control does affect the liver of a woman, which is primarily responsible for fertility. But does birth control cause cancer? What are your perspectives?
This studies is not let's say it's weak so far. They trying to find like more cases and more like percentage that it's could be true. But again, I would say cancer in general, it's not only one problem. It's not about that I'm taking something or I'm not taking something. It's a combination. As I said, it's a combination of set of mind, because let's say in Chinese medicine, everything that we when I doing diagnosis, I apply 5 elements. So 5 elements, it's a fire, it's like wood, but each element has a emotion. Let's say liver, we have been talking a lot about liver, right? So liver, it's anger. I mean, the emotion of the liver, it's anger. So if the person angry all the time and overthinking or have been having fear, their energy is gonna be blocked in some certain levels. So it's like set of mind, and set of mind creates the blockage in certain areas. Less blood circulation, and less blood circulation collects, let's call it some trash that the body should release, but body is collecting that trash. So, and this one, and as we said that the birth control can stagnate the liver and slow down the blood flow, venous blood flow. So you just can apply everything that I said. And of course, if like set of mind, poor blood circulation, blockage, and emotional aspect, all of this creates an lifestyle that some people even they don't care about what they're eating. So like these 4 elements will create some problem.
So if someone comes to you for their infertility dilemmas, do you ask them, what's your lifestyle like? What are you eating? What are you putting on your body? Are you wearing perfumes? Are those things really, can those really cause infertility in women?
Yes, of course. First of all, yes, I'm asking what your diet, what's the type of your diet or maybe some people don't follow any diet, but I'm asking, tell me about what you eat and what you don't eat at all. What about your, again, sugar consumption, because the sugar affects on the blood flow as well, and infertility level as well. Second, it's exercising. Of course, we in LA, I don't know, I'm not talking about any other, part of the world, but in LA, we all the time we're in the car, right? We're sitting behind the wheel, driving in the traffic, and, again, it's a stress and all of these aspects. So again, when we have been sitting, we're blocking, because of the specific breathing, we're blocking the diaphragm. Diaphragm, it's a muscle that helps to, with the breathing, it helps to bring this enough blood from the liver channel to the heart channel. Because of the, I mean, it's another subject. I just say that sitting behind the wheel is blocking the muscle, the diaphragm, and collects a lot of stagnated blood flow in the pelvic area. So of course, I'm asking about lifestyle, about exercising, and about diet. All these 3 aspects will affect on the fertility because of the, again, blood flow circulation.
Can you explain to us how that blood flow, the lack of the blood flow circulation affects us getting pregnant? And why is that important?
Because it will affect on the ovulation first. So if it's poor, if it's a poor blood circulation, the ovaries, they're gonna be, will receive less blood flow, will receive less hormone stimulation, and it, because the main idea for the ovaries, it's making, going through the ovulation process, right? So if the blood flow is less and all these, consequences, there is no ovulation.
Wow.
So no ovulation, we're not gonna talk about, progesterone level, and we're not gonna talk about, the lining is gonna be thin in the uterus, because if all of this aspect will affect on the lining, and the lining, it's like environment that should be warm, welcoming, and again, it should have enough blood. Sometimes, I do some treatments for my patient. They could have normal ovulation, but the uterus could be cold. Even in Chinese medicine, we have a diagnosis cold uterus. So it's a particular slow circulation in the uterus, and making the lining is very thin. Of course, if hormone level affects on the lining too, but environmental things like cold, like I said, that's why in Chinese medicine we use the aspect of coldness and cold and heat. So less circulation could create less warm environment in the uterus. So, and it will be effect on the fertility level.
Is that the same thing for miscarriages? Because it's cold and the lining is thin?
Yes, almost the same. Yeah, and also it's during the pregnancy, the level of the progesterone should be higher, but it's not going to some, certain level. And it, again, progesterone should create more heat, more warm environment in the uterus. But if the progesterone level goes down, it's gonna be coldness in the uterus.
And is the liver responsible for that?
Of course, because the liver creates, that hormones. It's support the ovaries, yeah. And
so this is amazing, and I'm learning so much as I talk to you that we can sit here and we can talk about birth control and all the research, and one can say it's not that bad, one can say it's good, but ultimately any type of medicine that a woman chooses to put in their body, whether even if it's like thyroid medicine, or whatever for autoimmune.
By the way, I'm sorry, thyroid, it's a part of the liver too.
Yes.
Okay.
Yes, for sure. Liver and spleen, that's what I'm learning, right?
No, there is a kidney channel that should be like a fire that support all these organs. Yeah.
Yeah, that's amazing. And so knowing this, I think as women, we need to understand that no matter whether you're choosing, there's nothing wrong with choosing to do medicine, birth control, whatever. But it's really an essential to understand that in the long run, it affects one of the most important organs that help us with our hormones, and that's our liver.
Yes.
And so we need to be really mindful of what medicine we're putting in our body. Elena, first of all, I want to ask you this. I have a daughter myself. How can I help my daughter having a healthier organ system, a reproductive organ system as she's growing up? What are some things that I can do as a mom to help her better reproductive organs so that she never comes across these types of issues when she's ready to, go through her menstrual cycle and all these things?
First of all, as a mom, you need to understand that there is a menstruation, that how it works.
Works. Yes.
Yes. And why we have it. For what's the purpose of the menstruation?
Can you tell us? We all know what it is. We go through the pain, but do we know what it is?
Yeah. Second thing, I maybe, I still have a very old-fashioned set of mind. I still think that early sexual life will affect on the reproductive
Don't worry,
situation.
we're all with you on my followers we're all that mental. Can you tell us how? How does that affect them?
Because, first of all, the body, let's say if it's before like 18, 17, 18, the body is not ready. The hormones internal organs, they are not ready for, to conceive. Maybe they are ready, but there is this kind of separation between energetic system and physical system. We need to, the brain and the person should be mature enough to, understand, because the sexual, intercourse, it's a process that it's not just, like having a food.
That's
And
right.
I would start, like probably with this part to explain that we have a menstrual cycle, and we could be pregnant, anytime, especially before, let's say, because we starting, our menstrual cycles from 13, 14, right?
We started around that age. I'm hearing 8-year-olds now.
Sometimes, yes, because again, because of the lifestyle, because of the diet, because of that, we have a lot of sugar in our diet.
And hormones, yeah, added.
It affects on the early menstruation too, and social media, and all this,
Yeah.
things about social media. All of this, it affects on, on, because I tell it, it's not physical, aspect. There is an energetic aspect of our system. So, and second, there is the sexual transmitted diseases that still, exist. And sometimes, I still believe in chlamydiosis, ureaplasmosis. It's a combination of virus and bacterial form that could affect on the fertility as well. And sometimes it's asymptomatic, and we could not, find, especially men, they could be asymptomatic and having this, let's call them viruses.
Yeah.
So second thing, if let's say it happens that the early sexual, life, I would say maybe it's better to use condom or barrier stuff compared to birth control, because at least there is some protection, kind of a protection. Yeah. So I would start, maybe from this point. It should be, educational, friendly talk, not that, you could be pregnant or you could have a disease, not like spreading the fear. No, it should be like
knowledge
talk.
instead.
Knowledge, yeah, that the young girl would understand. Oh, okay, if I'm choosing someone, but we kind of completely forget about emotions. We just, talking
As a
about,
teacher.
yeah, but like, it's like a food that we have to have it. No, first it's the emotional aspect, that will support our liver as well.
That's right. What are some of the foods that you are aware of that affect female reproductive system?
Sugar is number one, unfortunately, because sugar is increasing the osmotic pressure in the blood, and could create that. We have been talking about stagnation, could create stagnation in the blood flow, in the pelvic area as well. Second, it's, I would say, kind of artificial food, that soya meat or something like that, that is kind of created. It's not nature. It doesn't exist in the nature. It will affect on the, again, because, liver needs to detoxify this. And the way how, we bring in that stuff in the liver to detoxify, we're gonna, use this resources of the liver, alcohol. But right now people, they don't drink so much. They have another, stuff. It's drugs and everything that relates to addiction too. But again, I would say number one for fertility, that could create infertility, it's sugar. It's a high sugar level.
What about smoking? Women smoking?
Again, it's the same. We the same channel. We are, like harassing the same channel. It's but here it's a different situation. It's from the lung. It's a lung will be harassing the liver. It's on the other side because of the heat that creates. The cigarette or vapes, they create, the heat that will go through lung channel to the liver channel.
Wow. Elena,
Yeah.
have you seen a success rate with, family that is trying to get pregnant and, there's an infertility issue? Does Chinese medicine genuinely help with fertility?
Yes, I would say I have a lot of patients that most of them they going through IVF procedures,
Yeah.
and of course it increase fertility rate, and because of that they could have more. They create more eggs in the ovaries, and maturity of the eggs. And I even recently I had a patient. She have been going through. She have been freezing her eggs, and it's a long way.
Mm-hmm.
So the first time when she have been doing this, the first trial, it was unsuccessful. But after the treatments, I have been seeing her 2 times a week for like a month, and she she got what she wanted finally. She was really happy because she was already close to her 40s. She was 39, and of course it's a chance for her to be a mom in the future, because as we have been talking before, the older we are, the kidney and kidney essence, kidney channel is kind of declining. So yeah,
That's amazing.
Chinese medicine is definitely helps with the fertility to
Then
increase.
why do you think it's not promoted more then? Why are we so quick to jump to other options? I mean, are we, I don't know. I mean, it's not talked about. Do you think it's not talked about as much?
I think so, because this there are some in the Western medicine anyway. It's
It's fast.
yes,
Oh,
and
seriously, it's fast. It's noticeable, you know?
yes, and a lot of course, a lot of money is kind of investing in researches in Western medicine than in Chinese medicine, because it's again, it's kind of a type of the business that it's difficult to compete. Chinese medicine can't compete with the Western because of, again, money wise and insurances, that covers. I can tell that most of the insurances, they don't cover fertility. Fertility treatments. They cover pain, but they don't cover fertility. So
Wow.
this is the answer. Why?
Yeah. Yeah.
Uh,
This is just fascinating to me that this is why I love doing what I do, and I love learning that being a mom too of a daughter, that it's really important for me to know that she has a little liver, and that liver needs to be nurtured and taken care of, and her kidneys. Like, we don't think about things like that. When we think about infertility, we jump immediately into the reproductive system and, oh, something's off, and it's like you visualize it. But when
mhm.
you look at it from a deeper perspective, it's like her organs are not properly working. There's something there. And we have people like you that are knowledgeable and say, hey, like, this is what we need to attack, because you observe the body, right? You check the tongue, this, that. So you immediately know.
Yes, and of course, I don't want to say that I disregard blood work. No, I really ask.
Yeah.
Ask my patient to bring the blood work, because I want to know what's going on in the system, especially with the like hemoglobin level, with ferritin level, with hormone level. Of course, it's important because it's kind of a feedback that we can see after the treatments. Let's say we have done some sessions, and then after like at least it should be 2-3 months after the treatment that we can check the blood work and say, oh, okay, we had this situation, and right now we jump to the completely new level. Because even sometimes the very simple thing that a woman could have a very low hemoglobin level, anemia. So what kind of what we can talk about fertility in this case? We just need to, it's already she has a essence deficiency.
Yeah.
And blood deficiency. We need to fix this first. Chinese medicine can help this too. We need to fix this first, and then we can talk about fertility. The body.
Yeah. Elena, for the people that do not believe in acupuncture,
Okay.
because there's this visual, and I've heard a lot of people say this, how can sticking a needle in a body help you with fertility? Can you briefly explain to us, how does a needle help with fertility?
Fertility. Okay, for fertility, we use points on the abdomen, on the lower part of the abdomen that kind of correspond to ovaries and uterus. And we have some points on the legs. So basically, our body, it's like a network, and it's freeways, because we have channels, 12 channels, and they kind of merge in each other. But basically what I'm doing and we are doing is like practitioners, we placing the needles, that area that I said that correspond to ovaries and uterus. We stimulate with the needle and electrostimulation, we stimulate that area. We attract more blood flow there. We remove the stagnation. Just, we making the blood flow normal and free. Second thing, when the blood flow is sufficient, it warm up the uterus too. After, when the stimulation is over, I apply Maxa. Maxa, it's a herb that applies on the needle, or I apply on ginger. It's a good treatment too, or direct Maxa. The same, it stimulates more blood flow, and it could help to keep the blood flow sufficient at least for 4 more hours. And these 4 more hours, will stimulate the ovaries, will stimulate the uterus lining. So some points we have on the legs as well, especially kidney points. It's close to the ankle area. To stimulate that area, we bring in more essence, we bring in more blood to the kidney. So for fertility, we need to balance liver, kidney, and support the spleen, because the spleen, it's a main organ who is gonna transform and transport that we just we have in our digestion system.
So from this conversation, another thing that I'm picking up is how important it is for your body to be warm.
It should be balanced, because when, let's say, we're getting older, especially women, we could create some extra heat, right? That's why someone could have hot flashes. But it's a deficiency aspect. We just need to, if it's too much, we need to clear the heat, or we need to support the kidney to make them, being more, that they could collect that heat and contain the heat inside. It's usually, there is a very visual thing. It's very interesting example, but this is true. So when we were, let's say, before 30s, 25, 30s. Our kidney, the volume of our kidney is like that. Can you see?
Yeah.
The big cup, right? So after 40s, the volume of the kidney is declining. It became smaller, like physically smaller. So, but the heat that the body creates, it's the same. So there is a difference, right? That we can contain the heat and this volume and contain the heat and this volume.
Yeah.
So in this case, we need to clear heat and support the kidney essence, because it's our bank account.
Yeah. Yeah, definitely. Another thing that I've learned from Chinese medicine is that it's important to not consume ice water.
Yes.
How effective is this on a woman's reproductive system?
So this aspect affects on the spleen, because the spleen, it's a very gentle organ, and to in order to, if we, let's say we consume the ice water, the body, the stomach needs to, first of all, digest, to bring the temperature to the same level that our body has. It takes energy. So it takes a lot of energy. In this situation, the body is spending more time and energy to digest this cold water, and of course, it will give less to the pelvic area is going to be the not priority. So to receive the blood and to receive the energy. So it affects on the spleen. We
Which is
recommend
the message deliverer and taker, right? Is that what you're saying? Is that what the
yes,
spleen does?
yeah, because it will affect on transformation and
There you go.
transportation.
Yeah. Yeah.
Yes.
Transformation. Wow. So yeah, that's one thing. Before we go, I think I am going to speak for all moms when I ask this question. When they're like little babies, I particularly see a lot of moms that have their baby, like baby girls, like barefoot, and it's like really cold outside, or they're dressed very lightly. Is it important to take care of, I mean, like how important it is to keep a baby girl warm? Is that harming their reproductive system when they're dressed lightly and it's cold outside? You hear our parents say it all the time, dress warm, it's freezing. But is this just a myth or is this factual?
No, it's true. For me, I usually, could be a little, not mad, but frustrated when I see the baby with no shoe and no socks. So, remember I said when you asked me how we are treating, how it's the fertility treatments looks like. So we apply some needles on the feet area.
Under the feet?
It's around the ankle area,
Okay.
and this area, it's on the feet. It's a kidney.
Yeah.
So kidney, they're supposed to be warm. Head, it's supposed to be cold. So, and of course, in the future, this, I don't want to say 100%, but they could have UTI problem. They could have, coldness in the kidney, and because I said the kidney channel, kidney organs, they should be warm. We should keep them warm.
Wow. I love that. I always think about that. I'm like, how is this mom? This child is barefoot. She's wearing a jacket and socks, but the baby. And I always think of that. I'm like, these little baby girls need to be taken care of, like their private parts, especially starting from underneath the feet to their like private parts need to be warm. That's what we learned as our culture. So
yeah. But
know.
medicine applies this to the system, to the channels, kidney, and liver and spleen again. It's start from the feet.
Wow. So then the conclusion to this is that majority of infertility issues among women, it doesn't matter whether you're in your 20s, 30s, 40s, it's a high chance, obviously, stressors, environmental stressors, but also the organs of a woman, particularly the liver and kidney and spleen, right, need to
Yes,
be looked at.
yes. They should have very good support. So one of
And
them
blood
should be
flow.
straight,
Yeah.
and another one should be warm and supported.
Wow. And that's what Chinese medicine supports. It's finding that balance versus, all
Exactly.
these medications and tests and things like that. Wow. I love
Yeah.
that.
We need to be in the harmony in 5 elements.
Yeah, definitely. Because when you look at the past two, our grandparents were incredibly fertile. I mean, they have 5, 6, 7 children, but now
Yeah.
that it's just so different now. It's the chances are decreasing. So that's why I wanted to talk about this, and this is kind of interesting. And you know what, Elena, I don't know if you kind of agree with me, but back then the women knew how to nurture their organs better. They had all these holistic approaches in their kitchens.
Yes, because we call it folk medicine, right?
Yeah.
We could say, okay, if someone has problem like kind of UTI, what we have been taking or drinking, it's a cranberry juice
Juice.
or cranberry, leaves,
Yeah.
right? So, but now they given antibiotics and say, okay, take antibiotics. But
Mhm.
actually, I want to add to the subject because UTI could be two type of UTI. It could be like a real UTI that developed because of the infection, like real infection, and non-specific. In Chinese medicine, we call it emotional UTI. You
Oh,
see,
wow.
two different things, and we
Yeah.
need to give two different remedies, right?
That's amazing. Chinese medicine always leads to like energy. That's, as you
Yes.
said,
Yeah,
energy, emotion, the well-being of a person. That's fascinating. Yeah. And again, what I'm understanding is that at the end of the day, whether you choose to birth control or not, it does its effect on female organs, which is primarily needed for reproduction. Wow.
exactly.
Fascinating.
Yes.
Thank you so much for today. I appreciate you. And yeah, you're
Thank you for
amazing. Wealth
inviting
of
me.
knowledge.
Thank you. Thank you. I was really happy.
I know, me too. Thank you
Okay.
guys for viewing.